Hello and welcome to the Pain-Free Cycling Podcast. I'm your host, Dr. John Schaefer, physical therapist and strength conditioning specialist. On this podcast, I will help you, the cyclist, take control of your health on and off the saddle. Whether you're rehabbing an injury, trying to bulletproof your body, or simply learning more about your health and wellness as a cyclist, you're in the right spot. My goal is simple. I want you to ride longer, ride stronger, and be able to soak up every moment the sport of cycling has to offer. So kick back, relax, and let's dive into the world of pain-free cycling. This first episode is really just about giving you some background on me, who I am, what expectations you might have for this podcast, and where we're going to go with this. I'm really looking forward to it. I've done a little bit of podcasting in the past, mostly for other physical therapists and physical therapy students. But now I want to go directly to the consumer, to the individual I'm trying to serve, the cyclist. So just a little bit of background on me. Growing up, I played basketball, I ran track and field, and had a whole lot of injuries along the way. I broke my leg, wrist, collarbone, had a stress fracture in my foot, surgery on my back, surgery on my knees, all really before the age of 16. So I went through a lot of different rehab, worked with different providers. Some were good, some were not so good. But I learned a lot about the recovery process. I learned a lot about the body. And this all kind of pushed me and encouraged me to pursue the field of physical therapy. So I ended up going to PT school in St. Louis, at St. Louis University. And during that time, I learned a lot about rehab. I learned a lot about orthopedics, learned a lot about, various avenues you could take within the field. And I also realized that I was extremely interested in cycling. I brought my bike down to school and was biking probably 15, 30 miles a week. But beyond that, every time I had any opportunity for a group project, or could pick my own topic in any class, I always found myself going back to cycling related topics. It was just something that always fascinated me, something that I enjoyed, and something that I wanted to learn more about. So I kind of moved throughout PT school, got through all the classes. Some I enjoyed, some I didn't enjoy at all, but cycling was always kind of there with me along the way. And I mentioned, I'm cycling about 15, 30 miles a week, and I started competing some races too, towards the end of my time in PT school. And with 2 weeks left before graduation, I actually got in a cycling accident in Emporia, Kansas, where I broke my arm and had to end my clinical rotations early. So that was really a bummer, but I learned a lot about the rehab process when it comes to upper extremity injuries. Then following graduation, I moved out to Boston to complete a strength conditioning internship. Worked a lot with high school, college, professional athletes, which was a lot of fun working on the higher end of the spectrum, really, getting to serve those kinds of individuals. And then after that internship, I went down to Houston, Texas, to complete an orthopedic residency training program to specialize in orthopedic rehab. So during that time, I was working with individuals, a lot of more Spanish speaking, underserved, really didn't have a great understanding of health and wellness. So between those two experiences, I really got the opportunity, to see both ends of the spectrum, those who had access to a lot of resources, the best equipment, and also those who had no equipment and didn't know much about their bodies. So it's really allowed me to develop a pretty good understanding of, how to rehab an individual based on, if they have a lot of equipment, if they have no equipment. I can meet individuals where they're at and really, educate and inform them to be able to make positive changes within their bodies. And I think that's, one of the most rewarding aspects of physical therapy. And then that's also, one of the things I want to do is spread a lot of education to as many people as possible. In this case, educate you as a cyclist, on how to make the most out of your time within the sport and how to, protect yourself from injury and how to set yourself up for success in the long run. So during that time where I was in that orthopedic residency, I also had the opportunity to do a capstone project, and I chose to focus on cyclists, injury rates, and strength training to see if there's any kind of correlation between the two, or three things rather. So I spent a lot of time talking to cyclists, getting an understanding of, what kinds of injuries, what kinds of problems they're facing, how they're training. Really got a lot of good insight that I'm hoping to break down in future episodes too. But after that experience, moved out to Denver, Colorado to, be in an environment where I could really enjoy the outside, whether that's skiing, whether that's cycling, hiking. The active lifestyle is super, super important to me. So right now I'm working as a home health physical therapist, and I have my own virtual therapy practice where I work with cyclists. So it's kind of a good mix of being able to still see patients in the traditional sense, rehabbing them, and then also working with cyclists who I'm very passionate about. And then I'm also currently studying for the orthopedic clinical specialist exam, or OCS. So I'm going to integrate a lot of the latest research and apply it to the world of cyclists, which I'm really, really excited about. So the format of this podcast is going to be pretty simple. I'm going to be covering a lot of training, rehab principles, discussing various injuries, common injuries that cyclists experience, and I'm going to try and give actionable commentary on how to maximize your health as a cyclist. So I want to make this as simple as possible for you. I want to give you tips, tricks, tools, all things that you can utilize in your training. And if you're injured, different things to think about when it comes to the rehab process. You can think of this as kind of a one-stop shop. Hey, I'm having this issue. I can, take a look at, get some basic information regarding what that injury is, have a couple ideas of things you can potentially work on. And if you feel like you need more, I'm going to, teach you different ways to empower yourself, to reach out to a provider, what sorts of questions to ask, what sorts of things to consider. Also, again, that you can take full control of your health as a cyclist. And then as this podcast grows, I would love to be able to answer any questions that come up too. So weekly, I'm doing, a lot of Q&As over Instagram, but I'd like to incorporate that into the podcast as well to try and get some more conversations going, as well as answer whatever questions that you all have. So that's about it for this first episode. Again, kind of just trying to lay the groundwork, have you get a better understanding of who I am, what I have to offer, and how we can help get your health moving in the right direction as a cyclist. So if you like this episode, feel free to leave a 5-star review. It's going to help undoubtedly in terms of finding more cyclists, giving them access to this content. If you are on social media and interested in more cycling content, you can follow me at John, John, Schaefer, SCHAEFER.dpt. And then if you are interested in working one-on-one with me, visit painfreecycling.com, and you can fill out the application for a free assessment. Thanks so much for all the support. Really looking forward to getting started with this, and we'll see you in the next episode.